You're listening to Chaotically Disciplined with your host Shannon and Zaida, two goofy real-life rave moms where we chat about fitness, parenthood, and our love of music festivals.
We'll show you that you can have mid-time management skills, occasional meltdowns, and be disorganized as fuck, but still always get shit done. All right, everybody, welcome back. Today, I'm going to let Zaida have the floor because I tend to be the one that yaps the most on all these episodes. Yeah, I'm a yapper. I'm the oldest cousin, so I think it's just sort of a natural like birth order thing. But I'm a talker anyway, regardless. So, she wants to talk about what her job as a physical therapist entails and how we work together. A lot of my programs, specifically the one that's going on right now, we're on week 4 of my 8-week ultra program, and that one is my only group festival program that has a really heavy mobility component that Zaida came up with. We worked together. I, as a personal trainer, know a little bit about, stuff in the PT physical therapy realm, some corrective exercises and mobility drills and stretches and stuff like that, but I am not a physical therapist. So having Zaida in my back pocket, she's been such a huge resource for me and my clients and my business. Anytime someone comes to me with an injury or an issue that I kind of know about, but I'm not 100% sure, I always am like, let me ask my cousin who's a physical therapist what her recommendations are, because I like to cross-check and also learn more things than I know. So she definitely helps me be a better trainer. I'm so happy that I'm fortunate enough to have her in my life as a resource, but I wanted to give her the chance to really discuss, like go a little bit more in depth as far as what she deals with, what she knows, what she can and cannot do as a physical therapist, and all of that. So I will let her get into it.
All right. I received my education at the University of Miami for physical therapy school, and my undergrad is in pre-medical sciences. I minored in health psychology. I've always had an interest in just nerdy science, but also the psychological component, how mind and body affect each other. So I went into PT school thinking, I'm going to be a very manual-based therapist, and I'm going to work with people like yourself, like the common person that may have an injury from they tweak their back or they are recovering from a surgery with their knee. We are capable of working with people in settings starting from getting out of a surgery, people that have cancer, any type of disease that you're going to see in the hospital because people are sedentary. They're, for whatever reason, either they're recovering or they're sick and they're in bed, and muscle wasting happens really quickly when you're lying in bed. So our job is to get them up, moving, and out of the hospital as quickly as possible. But then you can see us in nursing homes, home health, working at schools. We work in people's homes. We go to home visits. We work in outpatient settings. Someone, like I was saying, that has like chronic low back pain. There's just so many things that we cover from head to toe um, in terms of treating people in the presence of pain. Now, that's not all we cover because there are people that are highly functioning that are training for some sort of athletic event or trying to maintain their athleticism. So that's kind of where we start to overlap with personal trainers and different people in this realm in terms of what we're able to do and what we're able to practice. So we provide programs that can help with recovery, but also, maintaining strength. In school, we have this general education and you learn a little bit about everything, and then typically people specialize. So people work with neuro patients, cancer patients, cardiac patients. Pediatrics is a whole different realm, right? I thought about pediatrics, but the thing is that if you're going to do anything with pediatrics, you have to be able to dive in. Like you're investing everything because it's a whole different world. But I wanted to do travel physical therapy with my husband, Craig, who I met in PT school. And so that required me to get some hospital experience. But while I was in physical therapy school, I became a Pilates instructor. So they go hand in hand.
Not specifically like reformer Pilates where you're using that machine, because like
Mm-hmm.
back in the day, the Pilates I took was just like you weren't using any sort of equipment.
Yeah.
So yeah, but you're talking specifically about like reformer Pilates is what you were doing or still do.
Mm-hmm. Yeah, reformer Pilates. There's the reformer. There's like a couple pieces of equipment that you can use, and it's using springs for resistance. So that's what's unique about it is the method that it's using to create resistance. It's not the same as traditional strength training, obviously with weights. And that brings me into all the topics.
That was
But
gonna. I
like
actually would like to go into that
Pilates
if
versus
we have
strength.
time this episode.
Yes. So I got my teacher training completed while I was in PT school, which was a doozy, okay? Because I'm like trying to juggle 10 things at the same time for no reason. I didn't have to do it that way, but I was like, let's just get it done.
And
And I did
still
the shadow.
raving and living your best life.
Yeah, I had to. And so it was stressful but worth it. And I love tying them together. So I worked initially in the Pilates studio as a physical therapist. So they had Pilates and physical therapy practice there, and I combined them. So I'm treating patients with physical therapy, different tools like my hands, and like and also using the Pilates equipment as therapeutic exercise. That's how I started, and then I started working in a hospital so I could prepare for travel physical therapy because a lot of the travel PT jobs are in the hospital or in skilled nursing facilities, so you have to sort of be ready to go. You need experience to get experience, and so we started doing travel PT, but it was not like a passion for me, even though I could still work in those places. And now I'm finally back in my realm where I'm working at a Pilates studio providing um, just Pilates, but I use my PT mentality in terms of how I create the sessions. What I'd like to talk about regarding physical therapy right now is that things have changed so much for the population of high functioning humans. So people that aren't in the hospital, things like that. So much has changed in terms of what's being discussed because of the internet and social media and quick bites of information. Um,
When you said that, I was wondering, like, if you knew why, like, what the reason why things have changed so much. Is it because more people are into weightlifting? Like, becoming a gym goer is something that has been popularized by social media? Is it because of social media, like you said, where people are getting these little nuggets of physical therapy? Is that helpful or hurtful? Like, what is the reason you feel like physical therapy, like just the whole field, has changed?
so it's interesting because it's sort of a dichotomous situation where you have the internet booming with all of these
Mm-hmm.
snippets of information, which is helpful because we can reach more people at one time, right? So that's helpful for information that's actually um, addressing things in a science-based manner. Okay, so obviously there's research surrounding certain things. Just because something is research doesn't mean it's not valid, but obviously it's supported with research and therapists that have read the research, put it into practice. So there's obviously some strength with looking
Right.
into stuff that has been validated. But then you have people making claims that aren't necessarily true, creating
Cherry picking studies, all this stuff happens, I feel
yeah,
like, in
yep,
any fitness umbrella. It happens with, you know, personal trainers, fitness coaches, people giving advice that really don't know what they're talking about, quoting pieces of studies that don't make sense and taking things out of context.
yes, exactly.
Maybe having the best intentions but not saying it properly, so then the consumer is not understanding the intent. So it's I totally understand, because it's social media is great because it gets this information out to more people, but then it also gets misinformation out to more people very quickly. And so totally understand what's happening in your field.
Well, and it's also kind of crazy because you have all the information, but the thing is that only a human can really apply that information to another human and understand all of the factors that affect that person
Right.
on a day-to-day
Like,
basis
yes, these are the rules, but there's still so many individualistic type variables from person to person that only a person can evaluate.
for now. I'm just kidding, but
Right.
take over.
Jeez.
But for now, we have a job.
Yeah, until the rise of the resistance or whatever it's called. I don't know.
For real. Oh my gosh. So there's that
Or let's take
aspect of it
over.
that's very helpful, right? That people are seeking this, more people are into fitness, working out. But then there's other part of the population that is a really large part of the population that is mostly sedentary, that isn't doing enough because of technological advances, because people are not moving enough, because of modern day conveniences. They're chilling more, or their jobs just require them to sit more for work. Or just high demand for work, not giving siestas, right? We're not living in Italy where people aren't living that type of
Right.
lifestyle. So things are different in different countries, but obviously here, the grind, the hustle is real. And sometimes people don't have the time or they don't have the perceived time, like we've talked about, to really fit in movement to their lifestyle. And movement snacks are probably my favorite thing to give to people because throughout the day, it's not just about like that one therapy session or that one training session that you have because that only covers an hour and 24. That only covers an hour and, how many hours during the week that you're awake and throughout the entire year. So what is this person? That's what we look into. Just like you though, just as a personal trainer looks into. What is your lifestyle? What is your typical day to day? And what could you manage, even if it's like the lowest hanging fruit on the tree? What can you manage to fit in to increase your metabolic rate? Going for a walk after dinner, standing up and doing a certain number of squats when you have a break from work, a small 2-minute break. It could be anything like that. That is going to at least get you on board for improved physical health. And so physical therapy, we're talking about like all types of movement. Do you want to improve your skill set in a certain type of movement, or your strength training and you're struggling with certain lifts? Can we break down those lifts, focus on different components of that movement pattern that you're trying to improve, and improve it with other types of exercises, right? So therapeutic exercise or corrective exercise covers such a wide spectrum of really any type of movement. It just is depending on how you're using it and why. Like what purpose is that movement gonna? How is it gonna improve that person's situation? Right?
I was hoping you would touch on this too. I wanted to go into normal levels of pain at certain ages, what is valid to continue to train through or, live with, because we're not meant to last forever. So there's going to be natural wear and tear on our bodies. So what is normal, manageable pain, and what is pain that you should be going to physical therapy for? Like that sort of thing.
So, I mean, different scales. Obviously, like RPE, rate of perceived exertion, is something we use to scale how difficult exercise is, right? So, a
Mm-hmm.
similar type of scale for discomfort and pain is along those lines where if someone's having a 10 out of 10, I need to go to the hospital right now, or I'm going to black out. Um, Horrible pain. All the factors about that person, you have to kind of get to connect. Their perceived pain is going to be different than someone else's,
Mm-hmm.
helping them to understand what does that really mean, and if there's somebody that is just really sensitive and is like, I'm 10 out of 10 right now, I'm dying. It's like, okay,
Right.
that's where you live, but that might mean that you are a little bit of a catastrophizing person. Different people though tolerate pain differently, and what's a little funny is that middle-aged men tend to have the lower amount of tolerance of pain. That's not always the case, but it's sort of like
Really? Hmm.
that's more of a hospital situation. So if people are
Hmm.
in acute distress or acute pain and they're really ill, but it's sort of like a joke where like always those middle-aged men that are like men that can't handle the pain. Meanwhile, women are like taking it like a champ,
Honestly,
go through a lot.
like everything hurts all the time, and I still have to make dinner.
Right. But as far as the age thing, it depend that I wouldn't say is dependent on the number in terms of age, because again, people have different types of pain tolerance depending on the person overall. Like throughout their life, that you could have someone that's 70 years old that has better pain tolerance than someone's in 30. But that it's more so about like what type of tissue damage happened. So if you had like a tear in your meniscus or your ACL, there's a timeline for each type of tissue. How long is it going to take that we can keep it safe? Keep your tissue safe and from decrease the inflammation process from ramping up more. But at the same time, continue to get things flowing and moving so you don't become weak because you don't. Rest is only helpful in certain situations. And that's sort of like a myth that has been busted where, like, you know, rice, just rest, ice, compress,
Mhm.
elevate. That's helpful in certain situations, but not for a big amount of them. Like, a lot of people use that as like a blanket treatment for things
Like,
because,
oh,
like,
just don't train it. You don't want to injure it more. Which, like you
right.
said, it's individualized. So there are some injuries where that probably is the correct advice. But what I've learned from you training clients who have had injuries before is there's a certain point where that's what you do initially in the beginning, but then you do have to train a little bit through the pain. You have to figure out your pain tolerance and start training again because it's actually going to be very counterintuitive to just not be training that area at all when it's injured. In order to rehabilitate it, you're
Mhm.
going to have to train it while you're still uncomfortable.
Yeah.
So that's why like you were saying, it's so individualized, and that's where you can get good information from social media and the internet, but it's never going to replace working with someone who can really help you understand when you should not be training and when you're going to have to train through pain a little bit.
Yes, exactly. And taking NSAIDs like ibuprofen and things like that
Mm-hmm.
to stop the inflammation process, right? Inflammation, anti-inflammatories can be helpful, but I won't get too much into that. But the idea that popping a couple of pills is what you need to do, it's just, it can be helpful for a little bit of time, but then you have to let that go and you have to start moving again. You have to start putting load onto the tissues and giving your mind the chance to say, okay, I'm afraid to be in pain again. I'm not going to compensate. I have to move into it just even a little bit. Gradual exposure to the movement again
Mm-hmm.
is one of the most important things when talking about psychology and pain,
Mm-hmm.
because people become very quickly afraid of moving into pain. So
Mm-hmm.
they avoid it with compensatory
Right,
methods.
and then you end up creating other problems that now you have to work on also.
Yeah,
Mm-hmm.
exactly. But it's natural. I mean, if you have a groin injury, like I had a groin injury, and let me tell you how I would just like moving my leg, like completely circumducting my leg to avoid that discomfort. And while that was helpful for me to get across the room really quickly, it caused back issues. And also, I wasn't taking the time to be patient to move slowly enough for it to be a better pattern of movement. So, patience is essential when it comes to recovery. People, want quick fixes, and obviously that doesn't help really for anything, especially
Mm-hmm.
to increase your strength, change your body, change your life. You have to see, movement as something that there's a lot of different ways to approach injury and also healing. So, learning and talking with someone can help you give you strategies that you may not know that you
Mm-hmm.
can use. While you're in that acute stage of healing, right? So, anyway, I mean, there's just the information regarding, like, you know, these couple of exercises are going to get you here and there. Like, they can be helpful, but there's infinite number of movement patterns to
Mm-hmm.
target a certain issue, or a way to strengthen something.
Mm-hmm.
And so, what I do really like about the way that internet has changed things is that it's because it's broadcasted more information and more people like showing like this is valid information. At least those people have demonstrated how important it is for physical therapists to use strength training more and to push patients and clients more than we would have before. I think
Mm-hmm.
the problem, not the problem, but in the past few decades, there were a lot more passive modalities. So, lying down and, receiving some sort of modality on you, whether it's massage techniques or ultrasound, Easton. There's all these different things that are great tools. Even, the manual therapy that I love to do, but people need to be active. You need to be teaching them to use their body. There's nothing that you can really do physically, like to an external thing nothing's gonna replace them moving.
Right.
So teaching them, um, you know, you've gone through physical therapy yourself,
I'm currently in it.
right? So has the thing is that there's a place and time for exercises that isolate certain areas
Mm-hmm.
or that are slow and gentle in the beginning. You want to build foundational connection with your mind to that area in your body. Are you actually able to isolate it without moving some other part of your body?
Mm-hmm.
Then you have to start adding layers. So that's what a therapist does, is that they figure out, okay, where are you in this process? Are you capable? Oh, you're capable. Yes, we can keep building, building, building. If you're not, we need to break it down. Oh, you're missing this layer of connection with your body. And
Mm-hmm.
so that's how I tend to approach treatments with people, is just understanding, well, you're capable of pushing that weight up real well, but you have a compensatory method that's happening, that you've developed, where especially movement patterns that are bilateral. So if you have like a chest press, a shoulder press, a squat, it's really easy to shift your weight onto the dominant
Without
side.
realizing it.
That
Mm-hmm.
other side is not going to look like it's wrong, like or the movement's
Right.
incorrect.
You don't
But
realize which one is picking up the slack if you're only doing bilateral movements. You need to be doing single side stuff also.
yes, single side, and I've felt this in my own body where like, damn, I'm so weak with certain things
Mm-hmm.
on that one side. And I'm just like, well, this is just how it is to be human. No one's perfect. No one has perfect posture. We all bend and move in all types of ways. We're chilling on the couch. No one's going to be like,
Yeah. Yeah. Or even like, like me, I'll sit in a chair and I sit in a chair, I'll sit Indian style, or I always sit and I always sit on, one side, more often than the other. Everybody, or when you stand up and you lean, you'll usually
pop.
rock to one side and that just feels natural and more comfortable for you, but you're creating a compensation. You're stretching a muscle and tightening it on the other side. And that is, if you're someone who, just moving through life, it's going to eventually probably come out in some way, whether it's a mild or a major problem. But if you're going to the gym, at some point, something's going to be exacerbated, whether you realize it or not, from just things like that, from just not. Because like you said, that's just how people are. You're not doing anything wrong. Nobody just sits totally
even
in their chair all day long. No one does that.
I'll never forget my mentor pointed out to me how driving is a constant for people where your right foot is always going to be further ahead and that makes your hips shift.
Mm-hmm.
So unless you have, cruise control. Right. Like if you have cruise control on, sure. But in general, it's just natural to develop some sort of weakness or strength on one side versus the other. So counteracting that is super helpful. And you can do that with therapeutic exercises that are traditional for PTs, but adding the weight is necessary. So I think what's so important to understand about strength training is that it is not this like this activity that's just for people who want to get in shape. It applies to, the benefits apply to literally everybody.
Mm-hmm.
I think that there's a big fear around strength training or that it's just for guys. Because I know that it's like, I've heard my mom say this multiple times. If you're watching me, you know, Mom, that that's a man's job.
That's a man's job.
And I'm like, while I do understand the idea behind that, I'm like, watch me pick it up.
Right. Well, and I think that's a generational thing too. And even for women my age, like in their 40s, it's still kind of a newer concept that we should be strength training for reasons other than aesthetics, which I literally had a consultation to discuss this with somebody yesterday who was considering becoming a client, and she's in her 40s. But there's nothing wrong with aesthetics or using your training to look a certain way. Like, I think that gets demonized too much. And if you're doing it healthy and you're not hurting yourself, then that can be 100% a reason for why you're training the way you are. However, it shouldn't be the only one. And if you're someone who is still hesitant or scared, and this is men or women, but this tends to, like you said, typically be women who are scared of weight training because they don't want to get bulky, which is really hard to do, by the way.
I just want to be toned.
Well, you know how you get toned is you have to have muscle and then lose fat that's on top of the muscle. So if you are not working the muscle, you're just gonna look skinny fat, which that's a shitty term, but that's what you're gonna look like. And so, but we're still just talking about aesthetics, and we're trying to get to the point of that's not what we're even caring about right now. The one of the top killers of women as they age is they fall down and they break a hip, and then everything goes to shit after that. The reason why people end up in nursing homes, a large reason, is because of the loss of independence. They cannot move around freely anymore. And the ways to prevent that are to care about your mobility and, corrective exercises and all of the things that are under your scope of practice, but then strength training to maintain that muscle, because muscle loss happens fairly quick, rapidly, if you're not using it after a certain age. And your bone health is directly correlated to the amount of muscle mass that you have. So if you don't use it, you lose it. That's what happens to your muscle as you age. So,
and it happens very quickly. Then, like I was talking about for being in the hospital, if you lie in bed for just a few days, the muscles of your low back, they get super weak very quickly, and that's over 3 to 5 days.
From a gym rat perspective, you start losing your gains in your muscle about 3 weeks of not training is when that starts to drop. Now, before anybody freaks out, if you're injured or you have a long break, Muscle memory is a real thing. Like, you can confirm this, and once you've developed a certain level of strength and like muscle, yes, if you're like sidelined and you can't work out for extended period of time like you used to, you will lose muscle and strength. However, muscle memory is real. So once you go back, you will gain that back much faster than it took you to initially get there. So, yeah.
Yeah, and I definitely see that with like patterns of movement. Like if I go skiing, skiing's like my other than tennis, skiing is my favorite sport to
Mm.
participate in. Like, I love it because over the years, like, I just can always pick it back up because and I can go once a year, or I can not go for a couple of years and you just pick that right back up. So it's definitely fun to see happen in real life, but it also is nice to see at the gym. I mean, obviously, when you go back, you don't want to be like racking on your max weight. You got to gradually get back into it, but it is amazing how you maintain, or it's easy to get back to
Mm.
that level. You don't have to panic about it, right? So, um, yeah, I think that there's so many different ways to talk about progressive overload and all those things that go into strength training that you're working with. The PTs also work with those components. So you have your flexibility and you have mobility. So flexibility is how far can you bring a joint through its range of motion. Obviously, some people are more naturally flexible than others, depending on their body type and their tissue types. Mobility is how do you move through your range of motion? Okay, so if you're doing mobility work, you want it to be more on the slow and controlled side, at least that you're very aware and present in the moment of what you're doing. Because you can feel when maybe, oh, when I'm going through that range of motion, say you're doing side lunges, right? You're standing, legs out to the side, and you're going side to side. Oh, when I get to that certain area, I feel a little stiff. Just going side to side, how does that feel? Um, you can do it without any weight, body weight, of course, all these things, but you do want to eventually load it. So there is an overlap when mobility and strength training actually kind of come together where you want to be in these positions of, oh, I'm stretching, sure, but you need to then load the stretch or load the position that you're stretching in. That is where you're going to improve or increase um, someone's ability to prevent injury is by loading themselves in that new end range. Because if you
Mm-hmm.
range of motion in that joint, or say you're in a lunge and you're really stretching and you get a little further than before, cool. But there isn't going to really be any solid change that stays unless you load it with some sort
Mm-hmm.
of tension or um, an actual weight itself. So there's just so many ways to do that. That's why you want to look for guidance because sometimes people go a little too hard and that's how they get injured because they are like trying to max out their range of motion or they're trying to add too much strength too soon in terms of like how much weight that they're using. So that's why it's nice to talk to somebody or have someone coach you through it, whether it's you have a physical therapy evaluation in person one time and one follow up. Will it cost you a little bit more at first? Yes, for that private one on one, but it's worth it because they're going to give you tools that, maybe you don't have to stay and go to a bunch of appointments. Maybe you do, maybe that's going to be helpful for you, but investing in yourself and your health is so worth it, whether it's PT or working with a personal trainer or a different health professional. It's worth saving your money or delegating it to that because it's like if you break down the costs, which is another topic we could get into,
Mm-hmm.
because the problem with outpatient physical therapy services is that a lot of the time people get frustrated as they should because they're working with a therapist who is seeing multiple people at the same time. And
Mm-hmm.
although some therapists are very good at managing that, it's just not the same as doing a one on one session. So that's why, obviously, taking care of yourself is important, however, you need to do it. But if someone's questioning, should I put my money into this? It's definitely worth it.
It's hard when it comes to something like physical therapy or personal training because most people, myself included, when you pay something that's generally not cheap, you want like an immediate return on that investment, on that cost. And so with personal training and with physical therapy, these are like long term investments. So it's really, really hard to get people to initially see the value in it until there's an issue. Like most people are not going to hire a personal trainer until there's a issue that they cannot solve themselves. It's not going to be a thing they do as like a preventative thing. Rarely. And it's not that is never the case, but most often it's not the case. Same thing with physical therapy. People aren't going to just, most people who don't know the knowledge that you have, which again, general population, not going to work on their flexibility and their mobility for like no reason. They're going to wait until they're injured and then they're going to start maybe caring about this stuff or not. Some people just get injured and either push through it, stop working out, go to physical therapy just for that, and then they go back to just not giving a shit about working on any of this or looking at it as preventative medicine. Like if I cared about this a little bit more, if I worked on this stuff a little bit more, I could be getting more out of my training and potentially, hopefully, preventing injury. Not that I'm never going to get hurt or never feel pain again, but I could be lessening that, you know? So you're paying this initial cost to hopefully prevent, there's never a guarantee, but to hopefully prevent, you know, injury, or paying this cost to a trainer to hopefully have a more longevity in general and a happier, healthier life and be a stronger person. You never know what can happen, but that's the goal. It's hard for people to see that, but that is the value. Like if you place value in that hope, that preventative medicine, like you could, it's not that you're never going to get injured, but you could be lessening the injury. You could be building a body that can recover faster from a potential injury. I've had that happen with clients, like where they have said, this is bad, but this would have been so much worse if I was a person who hadn't started working out like years ago.
Yeah, that's how I feel about my C-section recoveries both times. Is that it helped so much to use the knowledge I had, but I also acquired new knowledge for myself in order to recover, and it has made the biggest difference for my mental health coming out of, because postpartum is its whole thing, where it's stressful beyond belief, and just having the ability to work through pain and the physical strength to recover, it just helps so much. So I totally agree with you. And one little semantic that I think is interesting is how like injury is not 100% preventable.
I can't remember if it was like Lane Norton or one of the people that I really look up to who are very like science driven people in the fitness space, when they talk about pain and pain management and working out during an injury or recovering or any of that stuff, it's like you said, pain, you can't really ever avoid getting injured entirely or having to deal with some level of pain in your movement through everyday life or in your workouts or whatever it is. So these are the choices that you're faced with. The two choices you're faced with, the bottom line is you can be healthy and deal with some level of pain at some point in your life, or you can be unhealthy and deal with whatever that level of pain is. And, you know, if we're using the information and, you know, coming to the conclusions and deductive reasoning, the people that are not caring about their health at all, that kind of pain and injury is going to more often than not be more extreme when they're going through it, and it's going to take longer to recover from. So you can't avoid it. So your choices are make it worse, or at least know how to manage it or prevent it from maybe being as bad as it could be if you just didn't give a shit at all about it.
From like your daily habits, maybe needing to incorporate little things throughout your day in order to obviously increase your overall activity level, or how you are managing your injury or managing something that you have going on with you. So not only can it be those little daily habits, but it could also be your mindset. It has to do with your belief patterns about your pain. And is this, oh my gosh, I'm in pain again from this old injury. Oh no. Oh my gosh, what if I can't walk tomorrow? It's been traumatic to heal through it. It's very easy to fall down those holes. And that increases your sensitivity to pain, and it worsens your perception of what the pain is. And it's just a whole snowball effect.
Right, and it's a vicious cycle because now you don't know how to accurately judge. Okay, the difference between, I mean, I try to teach my kids this, but it's something that comes up with clients, and you probably see it with patients, is this discomfort or is this pain? Like, just because it doesn't feel good or it's uncomfortable doesn't mean it's pain in the sense of you need to stop doing this or something's wrong. And so teaching a client or a patient to judge that accurately can be kind of difficult, because I'll have people tell me an issue that they had when they were doing a movement, and if I'm just applying it to myself individually, for me, sometimes it doesn't sound like an issue. I'm like, sometimes I'll tweak something and I'll keep working through it, and it's just not a thing. It's just a discomfort, weird little tweak that happened. But other times that little tweak can signal a bigger problem.
So the belief system stuff about pain is really important. And you could be someone like, for me, I can catastrophize when like I'm having an old injury flare up. It's funny because I like to work with people that have chronic pain issues, is because I have chronic pain issues and I can spiral. And so my number one thing that I teach people, and everyone needs to understand, is how to manage your breath. How to manage your breath, because that connects you to your nervous system as fast as it, like faster than anything can. And if you can manage your breath through ratios of breathing, longer exhales, that's going to help your nervous system from being in fight or flight, and take it down a notch, take it down to neutral, basically, or to calm your nervous system. You need to know how to use your breath, utilize it as a tool in relation to your pain. That's going to keep you objective when you are experiencing something that can make you become emotional, and that's how things spiral. So using your breath is my favorite way to help people get out of their heads, come back into their body, help them move through discomfort, because obviously pain in itself is not necessarily a bad thing. It's a signal to tell your body something, right? Or tell you something that, okay, something's wrong, maybe something's weak. Oh, okay, I need to strengthen that, instead of being like, oh no, I'm injured, I can't move anymore today, I gotta like lay down and sit down. No, you can take your time to move through the discomfort. And there's so many details that we can go into about that, but um, the way that you perceive discomfort in general, and then obviously pain, is going to change from person to person, culture to culture, and that is how it's very complicated, because it can be rooted in trauma. Trauma is definitely one of the most interesting things to me, because you can have your acute traumas that are, oh, I fell off my bike and I, hurt myself, or you can have serious trauma like PTSD from war and an injury that you acquired there, and that can cause all types of symptoms to occur throughout the body, because you have to acknowledge the psychological component of trauma.
Right. That is like, I think, factors that most people don't consider. Like, I know, again, I'm not a physical therapist, so my knowledge is much more limited with like pain and injuries and treating all of that and stuff like that. But I do know that like if you have like a spasm that gets set off from an injury, or you work out and you tweak something, generally with injuries or spasms, muscle memory works with muscle growth and strength. It works the same way with injuries. So your body you're more likely to continue to like re-injure a spot or get spasms to the same spot once it happens once, because your body remembers like, okay, this was hurt. And so when something is slightly off, it'll seize up very much faster than it did initially, because it's trying to protect you from having the same thing happen again. But then it kind of causes that spasm problem, and now you're like, shit. So is there something to, like you said, not that you're necessarily causing that pain response or causing the injury, like if you were to land wrong during a lunge on your knee that previously you hurt, and are you saying, or do you know, if I were to let my brain spiral out of control, am I more likely to have that injury now act up than if I had done the breathing you're recommending and slowed down? Could I have prevented that response from happening? Which seems like generally most of the time it's an involuntary reaction. It's your body doing what it thinks it's supposed to do to protect you from hurting yourself again. Potentially, can you prevent like things like spasms from happening if you were to just like take a beat, calm yourself down? Like is there something to that? Can you prevent that injury from flaring up if you don't freak out initially about it, or are you not able to? Like, do you know one way or the other? Or
I would say if you can nip it in the bud real quick. Whatever ramped up, you can ramp it down a lot faster if you're able to slow yourself down. You cannot prevent, say, that spasm from happening. If it's a signal, it's happening, like you said, involuntary. So no, you can't necessarily prevent it. However, you definitely can decrease the amount of time that you spend in that state where things are spasming or tensing up, through slowing it down, breathing, and then being able to say, okay, I'm going to move consciously, maybe a little more slower, and so therefore you could prevent something from happening.
Okay.
Yeah,
Yeah.
those spasms that you have, I think it's about how quickly you connect with the problem. So take the time to do some sort of, or find some sort of mobility work, whether you've seen a physical therapist or not, or you're a trainer or something, to give it attention. The goal is to not avoid it, because if you avoid it and you keep letting, you know, it just kind of be under the carpet, whatever
Mhm.
happen, it's just going to keep stacking. It's going to
It's
keep
going to keep
getting.
stacking. And like you mentioned earlier, now then you're going to probably develop other compensations that are going to lead to other problems that you're going to have to work through. So by completely avoiding working through any pain at all, unless you have like a broken bone, you know what I mean? These things are different than like some of these other injuries that maybe need a very short period of time off, but then you will have to train through a little bit of pain to rehabilitate yourself. And not we're not saying train the same way, like you mentioned earlier. Not You're probably going to way back off the weight. You might have to modify whatever the exercise is, but you're going to have to train through that pain in some way to avoid other potential compensations that are going to cause worse injuries, or if not worse, the same, but more injuries that now you're going to have to be working through.
Yes, the number one thing for me when I have a flare up of something, I'm like, okay, let me adjust my alignment, let me breathe, slow down. In terms of alignment, what I mean is that I'm adjusting my posture, trying to be a little more upright, brace my core when I'm on the move, because that way I'm giving stability to those areas that might be bothering me actively. In daily life, you can't be stabilizing your core all day. No one's going to walk around with a braced core. That's not what you're supposed to do. You shouldn't do that. But at least in those moments, I'm giving myself that extra point of stability. So then I'm also helping my psychological self that is freaking out. So I'm obviously giving myself something physical by bracing, by breathing, by paying attention, slowing down. And that way I know, okay, at least I'm doing what I can for now. First thing is just center yourself and then figure out what are you capable of doing to address the problem that day or as soon as possible. And if not that day, so for me, the example I have is that I had a groin injury a few years back, flared up recently, but I have a toddler running around and a baby. So I can't do exercises right away that would directly approach that or strengthen it or stabilize it. So I'm like, okay, I'm going to breathe, take my time because the movement's flaring up as I'm moving quickly. Just bring awareness. And then the next day I did a leg day and I brought, I decreased my weight a little bit, gave myself more time to warm up into the exercises, took them slower, focused on eccentrics. I stabilized my hip by strengthening the area and giving it support. So that's kind of the method that I use for improving the symptoms that I have. And that's just from my own experience.
So I feel like that's a good example to kind of lead into what we want to wrap this up with, which is, why should someone, maybe a gym goer or a gym rat or a trainer care about having someone incorporate mobility or PT work into their program? Like why would, even if they're not injured, why does it matter? And why would a, physical therapist, why would they want someone strength training? Like how do those two things benefit each other and play off of each other to enhance both? Like why should me as a gym rat, why should I care about mobility work or flexibility work if I'm not currently having an issue? Or why would you as a physical therapist want somebody to be strength training if maybe that wasn't an interest to them at the moment? Like how do those two things like enhance or complement each other, I guess, like in your opinion, or based on what you, not even opinion, like the knowledge that you have, like, what would you say?
I would say that so obviously there are multiple planes of movement, and traditional strength training is excellent for certain planes of movement. At times there are more dynamic movement patterns that could be used to just enhance your training, to just get you stronger in a way that you didn't think you could, right? So it adds a dynamic component to your training that can increase your gains. So the mobility work can help muscles to strengthen more or to fire better because you're actually increasing their ability to stretch and contract.
Move
So
through a larger range of motion, move properly through that larger range of motion, so then
with
you're training your muscle correctly. Because a lot of people might think that or even their form looks good and maybe it feels good, but they could be getting more depth out of their squat, which means they're getting better strength and eliciting more muscle growth and retention, you know, same, or pick any compound exercise or movement, right? We think that, like you touched on earlier, you might not want to look like a gym bro or a bodybuilder, and that's totally fine. Most people don't want that. They just want to be in some sort of, you know, fit shape. But it goes beyond that. It's caring about these things, strength training, continuing, you know, especially as we age, caring about maintaining your muscle or even building it if you want to, but at least maintaining it so we don't lose it helps us move, you know, better as we age. And the loss of mobility is the reason why people end up in nursing homes. So you want to be able to just be freely independent. You're going to have to strength train, and strength training is going to be better and less likely to cause injury and other issues if you have the PT element, the mobility, the flexibility, if you're maintaining that, because you're moving through a proper range of motion pain-free if you're doing these other things. Like, yes, on my end, that's how I see it. So I'm sure that you see it even more.
Well, it's just that you realize that strength training is so functional and so practical for everyday living. We lift things up all of the time, whether it's children or heavy groceries, or we have to do some sort of home repair project, or we're literally moving from one place to another. You have to lift objects, and that's what strength training aligns with, is obviously doing just that. Giving yourself, and this is the big, I'd say the big focus right now of physical therapists are trying to promote, that it's not about that you can't move through a certain movement pattern. It's that you don't have the capacity, your tissues don't have the capacity yet. Mm-hmm. And I say yet because you can do it. You can work through those movement patterns. It's just that you need to expose yourself to that movement pattern and then give yourself the tools in order to do it and have the capacity to meet that demand. And that's what's needed. It's not so much of, oh, you're older, so you shouldn't be moving like that. No, you definitely should be. It's just that someone might need to guide you there, or if you have injuries. This is a quote from Katie Dabrowski. This is a physical therapist that I went to school with, that was in the class below me, but she's the GOAT. Let's just be honest. The GOAT. And she talks about how we need a point of entry into the movement. So where is that person able to tolerate the movement, even if it's from this angle or at this level at this moment, helping people to find access into a movement pattern or an activity, even if they need to have it broken down into pieces at this time, whatever's going on in their life. So I think it's just really important to think about that, because maybe people avoid certain things, you know, activities, or just because they're afraid it's going to hurt them, they're going to hurt themselves, or that there is something that is in front of them, like I'm too old, or I'm a woman, or, you know, I can't do that because of XYZ. I think what is so helpful about having a coach or a therapist next to you, because they are going to encourage you to figure out how to get to that point, unless it's something like cray-cray.
It's important for everyone, whether you like have very limited or like no knowledge about this stuff, or you're someone who feels like you know all kinds of things. Like, I'm a coach, and I for a long time thought I couldn't do deadlifts anymore or bent over rows because I was having really bad lower back pain. And no matter what I did, no matter how much I backed off the weight or different variations, they never felt good. So I was like, I'm just going to have to get rid of these in my program and not train this movement pattern anymore. And I went to physical therapist, and the issue, not that I didn't have issues with my back, like there's like mild narrowing in certain areas and stuff like that. But the issue was my foot, the things I was doing with my feet. And so you might think you have an idea of the cause, and you might be doing your best to your ability with the knowledge you have to fix it. Or again, your idea of fixing it is just avoiding doing the movement entirely because you're scared of making it worse, which is understandable. But if you go to someone else who can look for things that you might not realize could even be linked, because so much is linked to things, like in one thing, like we've talked about already, can lead to another thing. It's all connected. It was, my issue was my foot. My left foot kept doing this weird roll thing on certain parts of the movement, and that was trickling all the way up to where it became a back issue. And I would not have known that. I could still be avoiding these movement patterns if I had never gone to physical therapy. But that physical therapist knew that I liked to lift weights. So it works together with, okay, when you do this, you need to be wearing these kind of shoes, or you need to be barefoot, you need to be paying attention to this. So it was never oh, you can't do this anymore. It
Right.
was how this, when you do this, this is what you need to watch for. And so they complement each other very well.
Oh, definitely. Yeah. Our whole thing is that we want to encourage people to reach their goals and do what they love. What movement do they need to return to that they love the most? Because that's quality of life. You're doing what makes you happy. And that's such a struggle for people that get injured because, especially high level athletes of any type, or dancers, things like that, because that's who they are. And so when they
Mhm.
can't do that, it creates so much distress. And so that's just the goal, is to help people to get back to what they love to do things that they didn't think they were capable of doing. And then more medical thing is like differential diagnosis, making sure that you don't actually have something that needs more medical attention. It's not just musculoskeletal. It is involving another system of your body that you need to go get checked out. So that's something that therapists also can provide, is the differential diagnosis of whatever you're experiencing, making sure that it's something that is treatable with a
Mhm.
therapist and doesn't need more attention.
I think today we have covered a lot, but by a lot, it's still just like the very, very tip of the iceberg with this topic.
It's a lot of information, and I definitely
Yeah,
don't want to overload people. But it's fun
right.
to talk about and important to digest some of this stuff, because this is talking about all human beings. All of us need to know how to move our bodies safely, but also know how to push ourselves
Hmm.
to get past our comfort zones. So
Yep.
we're here for it.
Well, I think we will stop for today. That's all we have time for. Bye, guys.
Bye.